So, again, let me welcome everyone. My name is Melissa Newton. I am on the board of the Kentucky Prevention Network, and I'm really happy to welcome you all here um, this morning for our spring training. We do have some um, wonderful guests with us who are going to share some great information about the medical cannabis program in Kentucky. But before we get to those introductions, I want to just give you some information about the Kentucky Prevention Network. The KPN envisions a state that values prevention professionals and prevention science in order to create a safer, healthier Kentucky. And our mission is to promote collaboration, training, education, advocacy, and networking for prevention professionals and prevention allies and supporters. So, a part of that, like it says there in our mission statement, is to provide educational opportunities. And so, to do that, one of the things we do is this spring training series every year. We also host our fall conference that will be happening at the end of September. And we'll be sharing some information about that towards the end of the session. So hopefully you'll be able to join us in person at our fall conference. But I want to get right into introducing our guests today. First of all, we have Mr. Sam Flynn, who is the executive director of the Medical Cannabis Program. And the mission of that program is to ensure Kentuckians suffering from serious medical conditions have safe, affordable access to medical cannabis. And we also have Mr. Rob Duncan. He is Kentucky's Deputy Attorney General and acts as the Chief Operating Officer and oversees the office's litigation, appellate, and investigative functions. And so Mr. Flynn is going to start up first, and then Mr. Duncan will speak after that and share some really great information with us. So, Mr. Flynn, I'll turn it over to you now.
Well,
And
thank
thanks
you so
everybody for
much.
being here.
Thank you so much, Melissa, for that introduction and particularly for reading off our mission statement. It's something that we feel very strongly about, and I'm very pleased to be joined by the Deputy Attorney General. I served in the Attorney General's office and certainly value the role that office plays, as well as Bruce and Briston, who are on this call as well. And certainly understand the role that the Kentucky Prevention Network plays and what you've talked about with the value of sharing education and providing educational materials. And that's really what we at the Kentucky Medical Cannabis Program, which will soon be the Office of Medical Cannabis here in the Cabinet for Health and Family Services, are intent on doing. We've hosted webinars with the Kentucky League of Cities, with the Kentucky Association of Counties, with the Magistrates and Commissioners Association, and we'll be speaking to all 15 area development districts. And I think we have 2 that we've covered thus far, and we'll have another one this afternoon. So we're really getting out and trying to spread the word. So with that, I do have a presentation. It is fairly lengthy. I will move through it fairly quickly, and I will speak very fast. Please drop your questions in the chat box, or if you'd like, please save them for the end, and I'm happy to answer as many questions as you all have to the best of my abilities. So with that, I'll move on to our presentation. So agenda, I want to talk a little bit about the Kentucky Medical Cannabis Program, who we are, what we do, give you a little background on how all of this will play out, give you a little information on the law that was passed in 2023 and some updates that were passed in 2024, and then provide you a regulatory update. So what have we, I'll say the Office of Medical Cannabis, been doing for the almost 1 year that I've been sitting in this chair, and I was sort of here myself with a backpack, and that's how this started last year. And then we'll turn it over for questions and discussions. So moving on, as Melissa noted, this is truly about healthcare. We want to make sure that Kentuckians have safe products that are medical grade, that they can use to treat their qualifying conditions in accordance with the General Assembly's intent that they be able to do so if they have one of the qualifying conditions. We're about affordable and affordable and accessible program as well. So what does that mean? We want to ensure that folks can actually afford the products that could be made available out there, and we want to make sure that there's access. And what does that mean for Kentucky? And as we know, we have a very geographically diverse state. We've got mountains, we've got lakes, and when it came to licensing, that's something that we took into account, and we'll talk a little bit about that shortly. So, Kentucky Medical Cannabis Program was established last year via Senate Bill 47. Senate Bill 47 is the law that authorizes medical cannabis here in the Commonwealth beginning January 1 of this coming year. And it required the cabinet and the program to establish all of our regulations and begin implementing those beginning July 1 of 2024. And as we'll talk about a little bit later, we have promulgated all of those regulations as of April 18th of this year. So we're moving fairly swiftly with this program and are in fact ahead of schedule with respect to some of the requirements in the law. So again, our mission is to ensure Kentuckians suffering with serious medical conditions has safe, affordable access to medical cannabis. These are folks that have cancer. These are folks that have multiple sclerosis, epilepsy, PTSD, could be veterans, for example, and some other serious medical conditions and symptoms of conditions like chronic pain, chronic nausea, and spasticity. So our leadership, I'm the executive director of the program and special advisor to the governor for medical cannabis. We have hired out our team. In fact, as of yesterday, we have hired our full complement for this office to implement this program. And we'll talk a little bit more about that timeline soon. We have hired a director of education and outreach who has joined us on this call, Alyssa Erickson, who many of you will likely see in the coming months and likely years, talking about the important pieces of medical cannabis, whether it's from the healthcare standpoint, the local government perspective, or truly the business perspective. Alyssa has many years of experience in the hemp industry and is a great addition to our team. We've also hired directors of licensure and access. So these are the folks that are going to be looking at the applications from businesses and the applications from folks with serious medical conditions. And finally, we've hired, as I mentioned, a director of enforcement and compliance, Shafiq George. Shafiq has years of experience in the cannabis industry from a compliance standpoint, great addition to our team, and is going to really help us ensure that businesses are following the rules and ensuring that there is compliance throughout the state and that we really have truly a secure system because while we want to make sure that these products are safe for our patients, we also want to make sure that our communities are safe. And I think that's a lot about what this what Kentucky Prevention Network is really all about. So I'll talk about this briefly. So we have two boards that are attached to the cabinet. One of them is the Board of Physicians and Advisors, which makes recommendations to the General Assembly and to the program about various pieces that impact sort of the healthcare aspects of the program. So the Board of Physicians and Advisors is importantly appointed by the state medical licensure board. So the Kentucky Board of Medical Licensure, the Kentucky Board of Nursing, and now with the passage of a recent law, shoot. Now I've lost it. We'll have pharmacists. Board of Pharmacy will be appointing one member. Apologies, it's a Wednesday. And these folks, they're providing us with recommendations related to the types of consumption that folks are recommended to have for medical cannabis, the amount of THC that's in products, the qualifying conditions that are included in the list of conditions. So these are truly medical professionals, and they are exercising their medical judgment and providing us these recommendations and providing them to the General Assembly. Some of you may note that this board recommended the expansion of the qualifying conditions to include some very serious conditions that are not currently in our list. ALS, for example, Parkinson's, sickle cell anemia, HIV/AIDS, glaucoma, and some other serious conditions as well. Moving on, the Team Kentucky Medical Cannabis Work Group. This work group was part of the governor's vision for this program, is we wanted to approach this from a whole government standpoint and bring in not just folks from government, but folks from local government and from the business and medical communities as well, and look at sort of big picture policy issues that may impact the program, that may impact the state. And so we have folks on there from various cabinets throughout state government, from agribusiness. We have folks that are advocates from the medical cannabis side. We have a physician, and we have local government officials as well, including a county judge executive and a Commonwealth's attorney from a law enforcement perspective. And they've really been doing yeoman's work since October when that group was formed. For example, one of the things that we looked at was occupational safety and health. The cannabis industry, for example, is much like other industries in agriculture, but it does have some unique challenges related to how these products are processed and how they're cultivated. For example, we have indoor cultivation and pesticides may be used. And how do you apply these and make sure that our workforce is safe? At the end of the day, we want to make sure that employers know what the rules are, and we want to ensure that Kentuckians are safe and can go home at the end of the day to their families. And so with their guidance and with the help of the Department for Workplace Standards and the Education and Labor Cabinet, we developed an occupational safety and health guide, and we're one of the sort of a leader state in that respect. And that occupational safety and health guide really addresses a lot of those kinds of concerns and unique challenges presented by the cannabis industry. And so that's just an example of some of the work that they've done. And they'll also be tackling some law enforcement guidance here in the very near future for our law enforcement partners who are so important. So moving through timeline. So Senate Bill 47 is the bill, again, that authorizes medical cannabis in the Commonwealth. That bill, the genesis of that bill started way back in, I believe it was 2016. There was a bill filed related to medical cannabis, but not a whole lot of movement on that. And really not a whole lot of movement until the governor announced some research in April of 2022 on medical cannabis, and then ultimately formed the Team Kentucky Medical Cannabis Advisory Committee. And that advisory committee was made up of law enforcement officials, healthcare providers, and folks from across the spectrum that would potentially deal with medical cannabis and looking at it from various lenses. As some of you may know or may have participated in, this advisory committee went around the state and took input from folks across the state and generated a report. That report found that there's overwhelming support for medical cannabis in the Commonwealth, and thereafter signed an executive order which does not legalize medical cannabis, is important to note, but does grant a prospective pardon to any individual who possesses below a certain quantity of medical cannabis, has a written certification, and meets certain other conditions. Following on that, the General Assembly, and want to take a moment to really thank them for their hard work at looking at Senate Bill 47 and putting that together, particularly Senator West did yeoman's work on this, and they moved that bill through in the 2023 session, got that passed, and the governor signed it on March 31st. I was thereafter appointed June 1. As I mentioned, it was me in a backpack, and we slowly built that team up as we went, created the Team Kentucky Medical Cannabis Work Group to look at policy issues. And by January 4th of this year, we issued our first 10 regulations, which have now gone completely through their ordinary regulations, have gone completely through the notice and comment period, have staff, or so after comment amendments, and should be reviewed by the legislature here shortly. Those regulations relate to how businesses operate. We'll talk a little bit about that. So cultivators, processors, producers, dispensaries, safety compliance facilities. Safety compliance facility, big word. What you need to know is that's the testing labs, and how they're going to operate. So what kind of security that they have to have on their facility, and they do have to have a significant amount of security. What kind of standard operating procedures that they have to have, what kind of policies do they have to have in place related to workplace safety, something that we touched on earlier. Some reporting requirements about the types of medical cannabis products that they are creating, selling, or cultivating for that matter, as well as some other regulations that touch on a number of cannabis related businesses. So a regulation related to how it's transported, from B to B, for example, how cannabis businesses can advertise. And the legislature touched on quite a bit of that. So our regs really track the law on the advertisement piece. It's fairly restrictive, but a lot of that is based on what the legislature requires. Very strict requirements around testing. These products are medicine. We want them to be treated like medicine in their creation and in how they are tested. So there will be multiple layers of testing. And then ultimately the packaging and labeling requirements. So what the package actually looks like. We've done some things to help our law enforcement partners on that front as well. And I'll get to that in a moment. Next, we filed regulations on March 14th, which relate to card holders. So folks that will actually interact with this system. And those provide essentially the process by which an individual would apply for a card, how much medicinal cannabis they can get, what the restrictions and rules are on that. And we'll talk a little bit about that shortly. Those regulations are in the notice and comment period. So if you do have comments on those, please feel free to go to our website, look up how you can interact with that and submit a written comment. Written comments close on those on May 31st. And we did do the public hearing on those today. On April 17th, the governor signed House Bill 829. This is a bill that made some tweaks that we'll talk about here shortly related to medical cannabis. And then on April 18th, we filed our final regulations, which relate to business licensing and how businesses can get licensed here in the Commonwealth. The application period, as you'll note here, is from July 1 to August 31st of this year. And the first day that Kentuckians can apply for medical cannabis cards is January 1st of next year. So we talked about our authorizing legislation. I won't get too deep in the weeds on that. What's important to note is that it is codified at KRS Chapter 218B. So if you do want to review that law, please go there. That will also now likely include the statutory amendments that occurred through House Bill 829. New legislation, and I'll only cover this because it was in the media, but there was some talk that our program would not be funded, and that there was some interesting language in the budget bill that conditioned our funds on the Board of Physicians and Advisors making a finding related to sufficient evidence as to the efficacy of medical cannabis, and that's up on your screen, the language. The Board of Physicians and Advisors has met and made that finding, and their letter to that effect is posted on our website for all to view. So those funds will be available and our program will be able to move forward. So just want to address that concern. House Bill 829. So very important bill. passed this year. I want to thank Representative Nemus and Senator West for their very hard work on that. It does a number of things that are very important for this program. First, it creates an Office of Medical Cannabis and an organizational structure. That organizational structure also has now some powers and authorities to actually implement and administer the program, including the ability to suspend licenses and some other things that are very important to make sure that this is a very secure program moving forward. Second important thing it did was it moved up the licensing date to July 1 of 2024. Particularly pleased with this because it really was a joint effort with the legislature. We both recognized that there was an issue, and that issue was that under the law as it was written, this office couldn't hand a license to a business until January 1 of 2025. Well, if a business is only receiving its license on January 1 of 2025 and patients are getting their card on January 1 of 2025, there is a delta between the cardholders' expectation that they will be able to purchase medical cannabis and the reality that there would not be any medical cannabis available because these businesses would just be getting licensed and just be getting started up. So we worked together to get some language, get that date moved up so that we could do licensing this year, so that those businesses could come online and start working through that process, so that we have medical cannabis available for folks with PTSD and cancer, et cetera, at the earliest possible date. It also, as I mentioned, added a member to the Board of Physicians and Advisors from selected by the Board of Pharmacy, and it removed the provisional receipt loophole. And this is really, really important piece here, particularly with the nature of this organization. So provisional receipt loophole. Under the previous law, individuals could have applied for a card, and regardless of whether they were approved or denied, they would have had or they would have received what's called a provisional receipt, and they would have been able to purchase up to 45 days of medical cannabis. Again, whether we approve them for a card or not. Once we denied them, they would no longer be able to purchase anymore, but then they could have just applied and applied and applied over and over again. And so this loophole, we recognize that in the law. We brought it to the legislature. Again, our focus is on healthcare and making sure that this is only going to folks that truly are qualified under the law as the General Assembly wrote it. So we worked with them to get that loophole closed, and now folks will not be issued provisional receipts. You have to be approved before you can purchase any medical cannabis in the Commonwealth. And then finally, some changes were made with respect to local governments, how they opt in and opt out. Moving on to regulations, we talked at sort of a high level about what these things do. And so I'll move fairly quickly through those to the businesses, licenses. So we have cultivators, pretty straightforward. They grow the medical cannabis, has to occur indoors here in the Commonwealth. Processors, they can process raw plant material into finished products. So think about edibles like gummies, et cetera, vaporizers or nebulizers. And in Kentucky, we have some new rules on vaporization products, and we can talk about that shortly. Producer, just think of it as it's a processor and a cultivator put together. And we will not be issuing any producer licenses in the initial license period. Next, safety compliance facility, as I mentioned, they're going to be doing the testing, and then dispensaries we're all familiar with. But I do want to note that dispensaries in the Commonwealth, because of the way that the law is written and the way we've written our regs, are going to be unlike dispensaries that may come to mind. Some of you may have traveled to states like Michigan, or states on the West Coast, Oregon, California, Washington, Colorado, where you have interacted with or seen an adult use market. This is not an adult use market. This is not some of the stores that you may have seen that are selling Delta 8 or vape products. So the smoke shops or gas stations, what have you. We have very strict limitations on what can be sold in these stores. So, nothing that can be used to actually smoke the product. Our law prohibits smoking of medical cannabis, and we want to stay true to the intent of that law. So we don't allow you to sell anything that would allow you to smoke medical cannabis in your store. We do not allow any products that could be consumed by smoking in the store. So pre-rolls or blunts or joints or anything like that, none of that is permitted to be sold in these stores. And we're going to police that very, very closely. In addition, some of the things that you might see in smoke shops or vape shops or adult use markets, food and beverage, that is prohibited. These are not gas stations. This is a medical cannabis program. It's a very strictly controlled one, and we want to make sure that this is truly about medicine. And so this is not going to look like a convenience store. It will look like the safest, most secure pharmacy that you've ever walked into, and that is our intent. Again, some of the security requirements. So there's age restrictions. Can't be under 18 and go into one of these stores. If you're 21 or under 21, you cannot purchase any vaporization product. We have strict requirements on testing. We require surveillance and alarm systems, and we require physical security and lighting security on all of these facilities. So applications for businesses. Opens July 1, as I noted. It closes August 31st. Anybody who applies, if they apply, submit their application, and there's a deficiency, we give them an opportunity to cure. To apply, you have to submit a non-refundable application fee. All of this will conclude by September 25th. So that's allowing for folks that may have applied late. We review their application and determine that they need to fix something. The last date on which we'll get supplemental information will be on September 25th. On October 1st, we will allow folks or we'll let folks know either you're qualified to enter the lottery or you're not qualified to enter the lottery. So your application is complete or it is not complete. Those that are not complete will be denied. Those that are complete will go into the lottery process. We will hold the license lottery in early October. Those that are selected during that process, and we'll talk a little bit more about that process, those that are selected in that process will have 15 days to pay their licensing fee or forfeit the license. And so that is the overall process. Now, what kind and how many of these facilities will we have? Again, this is going to be a very, very limited program. We want to grow as our market grows, and there's a lot of reasons for that. So with that, we will issue 10 Tier 1 cultivator licenses. A Tier 1 cultivator license is 2,500 feet of indoor growing space. So very, very small. It is a micro cultivator. There will be 4 Tier 2 licensees. Tier 2 cultivator is 10,000 square feet. So a little bit larger facilities. And finally, Tier 3 cultivators. We will be issuing 2 of those licenses, and those are 25,000 square foot facilities. So very, very large cultivation facility. We will not be issuing any Tier 4 licenses this time. We do not need the square footage of cultivation space at this time. As our market grows, the need to issue additional licenses may occur. But until that time and until we know more, we feel satisfied with this level of licensing. Next, processors. There will be 10 processor licensees in the Commonwealth. And important to note, cultivators and processors can locate anywhere in the state that they choose, so long as the local jurisdiction has not opted out. There will be 48 dispensary licenses. And I want to talk a little bit about that. So our program is truly about access. And as I mentioned, we're a geographically diverse state. We wanted to make sure that there are truly access points throughout the state and that these don't bunch up. As we've seen in Michigan and some other states, when a medical program comes online, you'll see a whole bunch of dispensaries pop up all in one location. The way we've set this up with our licensing process, that will not happen. And we've done that by establishing medical cannabis licensing regions for dispensaries to ensure that there's geographic spread. So if you're a cancer patient in Pike County, you're not driving to Lexington to purchase your medical cannabis. But also ensure that these are not cropping up multiple in any community. So these are dispensary licensing regions. We worked with the Kentucky Transportation Cabinet to determine a map that is based on drive time. We wanted folks that are in any county to have the shortest possible drive time to the dispensary nearest them. So there will be 4 licenses for dispensaries allowed in each one of these regions, with the exception of the one in surrounding Fayette and Jefferson County. So Lexington and Louisville each are allocated 2 licenses off the bat in those counties. And then those surrounding counties for those regions get 4. Every other region gets 4. No more than 1 license per county. So if you look at the Eastern Kentucky or Southeastern Kentucky region, if Pike County has a license, they cannot have a second dispensary license. So we've done this to ensure, again, geographic spread, and that, these are limited in our communities. Oh, hold on, I think I lost y'all. Moving on, so this is under ideal circumstances what that drive time looks like. So the green is between 0 and 15 minutes. The yellow is 15 to 30. Orange is 30 to 45, and red is up to 60 minutes. The areas in white, which are very few here, are the areas that would be outside of an hour's drive time. And again, this is under a hypothetical circumstance. Once we have dispensaries licensed, we will run this again and determine where there might be deserts and some access points that we can work around. So moving on, license fees, not too terribly interesting. The lottery process, so how businesses actually go through that. So without getting too deep in the weeds, we are going to have the Kentucky Lottery Corporation provide a random drawing to our program. That will be our lottery process. We will provide the qualified applicant information to the Office of Legal Services in the Cabinet. The Office of Legal Services will de-identify that information and provide it to the Lottery Corporation. The Lottery Corporation will do an anonymous randomized lottery of that de-identified information. It will be provided back to us with the selectees. The selectees will be re-identified and then provided to ultimately myself, and then we will provide to the public the winners. All of the selectees. All of this will be live broadcast or live streamed. So folks can watch this from cradle to grave. And again, we selected the Kentucky Lottery Corporation because they're truly the professionals in this space. They just had their 35th anniversary. They hold random drawings like this every single day of the week, even on Christmas, which I did not know, and which they are apparently very proud of. A lot of states are moving to a lottery process, and some of them are very interesting. I think Rhode Island, they had their executive director wearing a blindfold and reaching into a fish tank with balls and picking them out. I will not be wearing a blindfold. You can count on that. We want to ensure that this is a fair and transparent process, and we want it to be run by the true professionals. So the Lottery Corporation will be assisting us with that, and we're very happy with that. Now, moving on to patient and caregiver regulations. So how will folks actually get an application? So first, they have to obtain written certification from a physician or APRN that is authorized to write certifications. So let's talk for a minute about that. The Kentucky Board of Medical Licensure and the Kentucky Board of Nursing were required under this law to write regulations that provide for how a physician or an APRN could become authorized to write these certifications. They have done that. It's gone through the notice and comment period, been approved by the legislature. and those regulations are now effective. So in the coming days and weeks, the Kentucky Board of Medical Licensure and the Kentucky Board of Nursing will begin accepting applications and approving applications for physicians and APRNs who want to write these certifications or be involved in this space. So moving back to the patient, patient will have to go to one of those physicians. We will provide a list on our website that'll be linked to a Google map so folks can find the one nearest them. Again, we want to make this as easy for folks as possible. We know it's difficult working with government agencies sometimes, so we want to make this very user-friendly to the extent we can. They will visit the physician or APRN. They will establish what's called a bona fide patient-caregiver relationship. They will go through the potential adverse effects or risks associated with medical cannabis. The physician or APRN will review the individual's medical records and ultimately will write a certification if that individual has one of the qualifying conditions. They write a certification, they hand that to the patient, and they also enter that into our patient caregiver registry, which is part of our IT systems. So they'll enter that within 24 hours. Patient will go online, apply. Once they've entered some key information, that certification will populate. They will click on that to associate it with their application. They will upload a notarized a form that says that they won't divert medical cannabis, and ultimately they'll pay a fee. If they are approved, they will then be sent via email a digital registry identification card, so their medical cannabis card. So requirements, I'll go over the general ones for a qualified patient. So first, resident of Kentucky. Visiting qualified patients are allowed from other states, but I don't want to get too much into the weeds of that because there likely won't be too many of those. Second, they have to have one of the qualifying conditions. And third, they must have no disqualifying felony offenses. And we're working with the Administrative Office of the Courts, so the judicial branch of government, and the Department of Corrections to ensure that we have that information about those individuals and can determine whether they do or do not have a disqualifying felony offense. Again, the conditions that I mentioned earlier, I won't go through those necessarily. So the information that they have to provide, we talked about that. Cardholder information, written certification, application fee, notarized signature page. And that is essentially their application. There is an application guide on our website. If you are interested in anything related to this, highly recommend you go to our website, which is kymedcan.ky.gov, and check out the patients page, which will have all of this information right there at your fingertips. The annual fee. $25 to apply the first time and $25 to renew. This is one of the lowest fees in the country, and we were able to do that. But first, we think it's important that folks are able to access this and that the fees aren't exorbitant. This is truly one of the lowest annual fees for a true medical program in the country, and we're very, very proud of that fact. We're able to do that by having digital registry identification cards. This is what the cards are going to look like. So again, they'll be emailed to you. You can print them out, or you can save them on your phone. They cannot be forged. They cannot be counterfeited. They cannot be faked. These cards are associated directly with the individual, and these cards are presented when purchasing medical cannabis at a dispensary. So you have to show these. You'll notice that there's not a picture ID on there with a government issued photo ID before you can actually purchase medical cannabis. And that's in the law. So some very important information on here. And I want to point out two things. First, the QR code in the bottom right-hand corner. This is for law enforcement. So that QR code is associated directly with that individual, and it's connected directly with our system. Law enforcement, if they stop an individual and want to see if this individual has a medical cannabis card, maybe they have medical cannabis in the car with them, They can scan this, it will pop red or green and immediately let the law enforcement officer know whether this is a valid card or an invalid card. We also have a backup. There is a phone number that will be for the program that will be on our cards. So law enforcement officer that may not have a smartphone can immediately contact us about that. Next piece, you'll see a barcode. That barcode is what will be scanned at the dispensary. So that will the individual at the dispensary that's employed there will scan the card. Once they've scanned it to do the purchase, the amount of cannabis that this individual purchases will immediately be deducted from the monthly allotment that's on the written certification for that individual. So if they're allowed, the raw plant material equivalent of 4 ounces and they purchase 2 ounces, well, then they'll have 2 ounces deducted and there'll be 2 ounces left that they can purchase at a later time. You'll notice the red card is for minors. You'll notice there's no barcode on that because minors cannot purchase. You'll notice on the caregiver card that there are 2 barcodes. A caregiver will be somebody who is purchasing on behalf of, or is a legal guardian for and purchasing on behalf of an elderly parent or a minor child. And again, remember that these folks are, they have serious qualifying conditions. So they have PTSD, they have cancer, they have MS, they have one of a number of very serious medical conditions. Oftentimes, and this is something we've seen in other states, is that elderly adults will be the caregiver for their significant other and vice versa. So an individual can be a caregiver for somebody who is a caregiver for them. An individual can be a caregiver for up to 3 folks, but that is the limit. 2 barcodes on that one. One is scanned for the caregiver, one is scanned for the patient. So that will show the amount that the caregiver can purchase for that individual, and obviously that'll be subtracted just as it would with the rest. False and misleading advertisements. So some individuals out there may say that they have a medical marijuana card currently. They do not. The cards that are issued by the state will be issued beginning January 1 of 2025. You have to apply to the cabinet. Businesses that are advertising medical marijuana cards are engaging in conduct that could be false and misleading. If you do have concerns about that, or know somebody who does, please refer them to the good folks at the Attorney General's office or to myself, and we're happy to refer them on to the Attorney General's office for further investigation. Moving on, supply limits, the amount of medical cannabis that an individual can have. So the cabinet sets the baseline for a 30-day supply. That is 4 ounces of raw plant material or its equivalent, which we've determined to be 28 grams of concentrate. So that would be what goes into a nebulizer or a vaporizer, or 3,900 milligrams of THC infused products. So think about edible products for that. And so there's some math behind this, and I am a lawyer by trade and not a mathematician, so I highly recommend you take a look at our regulations, which provide the formula that we used for this. And we're very proud of the fact that we're one of the few states that actually put the math out there that we have used to justify this breakdown. Moving on, we've talked about this. So just a couple pieces on our IT system. So we've talked about business licensing. All of that will be online through our business licensing portal. We've talked about the patient caregiver registry. So physicians write their certification into our system. Our applicants that are patients will apply through our system. And then ultimately, important piece, seed to sale tracking. So one of the very important pieces in Senate Bill 47 was the requirement that we have a seed to sale tracking system in place here in the Commonwealth. This system is vital because it allows us to see all the medical cannabis that is grown, processed, produced, tested, et cetera, here in the Commonwealth, from the seed all the way to the sale. One of the things that we're required to have is an adverse event reporting system. And while we don't anticipate having a significant amount of adverse events reported because of our strong testing requirements, if we do have an adverse event reported, we can look at the products that that individual has purchased, and we can track them from that purchase all the way back to the plants that product was uh, produced from, or the plants that product was produced from, and find the issues that may have caused that adverse event. We can issue recalls, and if there's anything more concerning there, we can actually suspend operations and quarantine certain products. So we have a lot of levers and a lot of flexibility to ensure that this is a safe and secure system. This will also be important for B2B transportation, and ultimately allowing us to ensure that none of these medical cannabis products are going to be leaching out into the illicit market. And we don't anticipate that necessarily taking place, because there's other places where individuals can purchase THC products, essentially recreationally. The Delta 8 that you see sold at grocery stores and gas stations and vape shops, etc. So we don't anticipate individuals trying to do that, but to the extent that they did, this seed to sale system will allow us to see all the medical cannabis in our medical cannabis program, and ensure that it's not leaching out into the illicit market. Local governments, important to note, local governments can opt out. County can opt out. City can opt out. They can do so in two ways. They can do so by ordinance, and they can do so by putting it on the ballot and the folks in that jurisdiction voting to opt out. Everybody starts from an opt-in position, and the very, very important piece there. If a county opts out, it opts out the entire county, including the jurisdictions within that county, not just the unincorporated areas. If they opt out, city can opt back in. So again, important to note, and the city can opt in basically the exact same ways that it opted out. It can opt in by passing an ordinance, or by putting it on the ballot. Also, if a jurisdiction opts out, citizens from that jurisdiction can opt back in by generating a petition and going through that process. Highly recommend anybody interested in this take a look at KRS Chapter 218B 130, which is the section that governs local governments, and that will provide you all the information that you need on this. And again, we've provided this presentation to KCO, the Magistrates Association, and we'll be doing this presentation with the Kentucky League of Cities tomorrow. So again, local governments can prohibit all cannabis operations, or they can regulate. If they have time, they can put time, place, and manner restrictions around this, just like any other kind of entity. School boards. Important to note that school boards can essentially opt out, opt in, or opt out if they choose. If they decide that they're going to allow this, they can create policies on, or they must create policies regarding how that's to be handled and consumed on campuses by December 1 of this year, so 2024. Important to note that schools almost universally already have policies in place on how students are administered different pharmaceutical drugs like opioids, and so that's something to take note of. Medical cannabis is going to be treated a little bit differently than opioids or any of the other pharmaceutical drugs that students may be administered on campus. For example, it must be out of sight of the students at all times. It has to be administered by it can never be in the possession of the individual except at the moment they are being administered it. It has to be administered by a school nurse or a school administrator, And the school nurse and administrator can essentially personally opt out. If they do not want to administer medical cannabis, they are not required to do so. So again, very important pieces. Local governments can establish and assess reasonable local fees to compensate for additional costs caused by the operation of medical cannabis in their jurisdiction. Um, if a local government allows medical cannabis to occur in its jurisdiction or decides it's going to regulate it, the regulations have to actually let the business, operate. You can't impose an undue burden or make the operations impracticable or unreasonable, etc. Okay, so again, important note, and this is more for the program than for anyone, is that if a jurisdiction opts out, they're required to notify my office within 5 business days of the passage of that ordinance. All right. We've touched on most of these pieces as well. Again, refer anyone interested in the local government aspects of this to KRS 218B 130. And please review those important provisions in there on opt-in, opt-out, citizen petitions, and requirements related to school district. One thing that we did do was we provided for informational purposes a zoning tool on our website. The one requirement in the bill is that none of these businesses be located within 1,000 feet of an existing elementary or secondary school or a daycare center. Now, elementary and secondary schools and daycare facilities were not defined in the law, so it's on the cabinet to define those. We have done so, and that's available in the definitions in 915 KR 1001, which is our definitions regulation. And so defined as public elementary and secondary schools and all KDE certified elementary and secondary schools, and then daycare facilities are specific regular group. And again, that's in the definitions regulation that we have provided both on our website and is available on LRC's website. So I've done a whole lot of talking and I've talked really fast. So I want to give you all an opportunity to ask questions, and I think several of you have. Okay. All right. So first question from Steve Cambron. What standards are used to ensure that these are medical grade products? So first, you'll need to take a look at our processing regulation, our packaging and labeling regulation, and our testing regulation. Those provide the strict requirements to make sure that these products, for example, don't have heavy metals in them, that don't have pesticides in them, etc. So there's very, very important rules and requirements around that. Highly recommend you take a look at the testing regulation. That's where you're going to want to take a look. Is inhalation permissible? So can't smoke it. If you smoke it, you lose the protection that the law provides for people who are doing it lawfully. Vaporization. Vaporization is permitted, but House Bill 829 from this year prohibits vaporization in public accommodations. So if you're going to purchase vaporization products, I highly recommend folks be very careful about where they are consuming those products so that they are following the law. So yes, inhalation is permissible via vaporization and nebulization. Let's see. Will applications be approved during the July 1, August 3rd, or will they not be approved until after that? They will not be approved until after that window. So that's that. Is there a reason why anyone without a medical card would be allowed into a dispensary? No. There are provisions for folks that do not have a medical card to enter a dispensary. That is in the dispensary regulation, but it's for individuals that may be independent contractors employed by another cannabis business, etc. So, for example, one of these facilities may have an issue with their HVAC. We want to make sure that their HVAC system is working. Those folks would be permitted on the premises to go ahead and fix that. Do note that there are requirements for these facilities for anybody from the public that does enter these facilities. They are required to have a visitor log for all of these facilities. So anybody that's not there for the purposes of conducting business will be required to state the reason why they're there. And that's required to be kept by the facility, and that's something that our inspectors will be making sure that they are keeping. Will there be a cap on the potency? So this is something that's written into the law. Highly recommend you take a look at KRS Chapter 218B, which talks about the limits for THC in the product. So, for example, it's 70% on the concentrates, and it's 10 milligrams of THC capped in all edible products. So edibles are capped at 10%, or sorry, 10 milligrams. Apologies. Per serving. Sorry, I'm just saying, will we receive the slides after this presentation? Yes, we can absolutely provide the slides for this presentation. That is not an issue. Did I hear correctly? Can purchase vape products from stores if over 21? Yes, vaporization products for medical cannabis are permissible for individuals if they are over the age of 21. Flower will not be for sale. That's incorrect. So the law provides for the sale of raw plant material from a dispensary. So what does that mean? Yes, I understand that individuals could potentially purchase raw plant material and roll it up and smoke it, right? That is absolutely something that is possible. People break the law all the time. Raw plant material is allowed for sale, and actually the law specifically lays out examples of where this might be used for a permissible and legal purpose. For example, brewing in teas or creating edibles in one's own kitchen for one's own use. Again, see amount of fee for licensure, please. I can go back to that, but I would much rather just refer you to kymedcan.ky.gov and go to the businesses page. Our licensure fee amounts are on the page. So scroll down and it's all right there. Who reviews the patient's applications? The good folks that will be working in the Kentucky Office of Medical Cannabis, and in particular the division for licensure and access, and particularly the folks focused on access. So that's on the patient side. Do we know what a disqualifying felony conviction would include? That is a great question. It is provided for in the law, and we've provided a guidance document that's on our website in the resources tab. Please go there and check that out. Let's see. What if the patient does not have a smartphone? That is a great question. Individuals can print these off. They can also apply via a paper application. We do not encourage that because of the time it would take to receive it, process it, approve it, and then mail it back to the individual. So highly encourage people to go the digital route. But if an individual does not have a smartphone, and they can do this from the computer as well. So I highly recommend people interact with the system digitally. We find that it's more practical for the patients and for the program. Let's see. At one time, I thought 2 medical advisors had to recommend for a person to receive a medical card. Is that still the case? It is the case for minor patients. For adults, it is one physician who has to establish a bona fide patient-caregiver relationship. With minors, it's 2. Will insurance companies cover this and or Medicaid? No. Medicaid will not cover this, and insurance companies are not required to cover it. That is in the law. That's KRS 218B 150. So the General Assembly stated sort of loudly and clearly that insurance companies and government benefit assistance programs are not required to cover this. It says, just to clarify, patients do not have to see. No, that is incorrect. Patients do have to see a practitioner in order to apply for a medical cannabis card. They have to go and establish a patient caregiver relationship, a bona fide patient caregiver relationship, which has a number of criteria. And again, the physicians that are authorized to do this are authorized to do so by the state licensing boards. And I assure you, the state licensing boards are very serious about ensuring that this is done appropriately. And the physicians and APRNs who do this are required to have additional education. Mary Birch says, you mentioned raw plant amount. How can will that be administered, taken, given? So that is provided for in the regulation and is provided for, more importantly, in the law. Law provides for dispensaries to sell raw plant material, as I mentioned earlier. Raw plant material in the law actually mentions that it could be brewed into teas or created into edible products at home. So next person says, so no cigarettes, right? Vape only. So no products are allowed to be sold that are intended for or could be smoked. And all raw plant material is required to be labeled, not intended for smoking. So we prohibit anything that would allow an individual to smoke raw plant material from being sold in dispensaries. So we're very serious about following the intent of the law here. And that the law says that it's not intended for smoking. With 4 ounces raw plant material possession allowance, will dispensaries sell raw plant material? Yes. If not, how would patients obtain raw? Yes. So yes, patients can obtain raw plant material by following all of the legal processes that are put in place by the law and by the regulations. Thank you. This was a lovely comment. When do you foresee that dispensaries will be up and running? So once we license cannabis businesses in the fall, they will begin operating. Now, important to note, the law provides, and we will not allow dispensaries to sell any cannabis prior to January 1 of 2025. And to be honest with you, they wouldn't be able to do so because there would be no card holders. And so that's just not going to happen. So a number of factors that will prevent that from occurring. So the reason for the moving up the timeline on licensing, again, something that we're really proud of. We're one of the few states that's sort of ahead of schedule on this. Again, is to let these businesses start building up their operations and getting ready for that January 1 timeline. It's likely that there will not be medical cannabis on the shelves immediately upon that date. We're not certain. Certainly with some of the small cultivators that might be possible, but we want to make sure that medical cannabis is available at the earliest possible date, and that's the reason why we push so hard to have that licensing timeline moved up sooner rather than later. Will there be any monitoring of doctors and APRNs to see if they're over prescribing? This is a great question, and actually, I am remiss for not covering it. So, the monthly allotment. So that's the 30-day allotment. What a patient can get is either at that 30-day allotment, the physician or APRN can write a certification for less than that amount or more than that amount. If they write it for less, they don't have to state the reason why. If they write it for more, then they do have to state the reason why. Every certification will be in our system, so we can monitor, number one, how many certifications the physician writes, how many of them are written for more than the 30-day standard 30-day supply amount. So we'll be able to see immediately if there are any questions about overprescribing or overwritten or overriding certifications, and we can report those directly to the Kentucky Board of Medical Licensure, the Kentucky Board of Nursing. We're going to take this very seriously. We understand the issue that happened in the opioid crisis over the last several decades, and that's not going to happen here. And we're going to make sure that it doesn't. let's see, is training required for dispensary owners and workers? Yes, absolutely. So we are requiring training that they have to undergo that is created by the Kentucky Medical Cannabis Program or Office of Medical Cannabis. So they will have to undergo extensive training on all of the things that we require in our regulations. And the employer is required to train them on all of their individualized. So every business is different, and every business will have its own special standard operating procedures. The employer is required to train their employees on those standard operating procedures and all the rules and regulations that we have as well. So want to make sure that everyone is trained and understands what is expected of them in this space. All right.
I do have a couple of questions in the Q&A section that aren't in the chat.
Okay.
If you don't mind, I'll
Sure.
pose those now, and we'll wrap up this portion of the presentation with these next few questions. Can you recommend sample school policies that districts can pull from?
So no, and school districts have to make their own choice about how they're going to approach this. It's the same with local governments. We really don't want to get between school boards and their students, and we don't want to get between local governments and their constituents. These are decisions that the law has set out to be made at the local level, and we want them to make them at the local level. What I can say is that there are existing school policies uh, throughout the Commonwealth on how medicine is administered to students in schools. This should be no surprise, right? There's lots of students out there that have very serious conditions, some that are part of the list, some that are not, and schools administer medications to those kids on a daily basis. So there are policies out there. Highly recommend folks take a look at those when making decisions about how to proceed.
Thank you. And our next one in the Q&A is, if a business has a license, will that license only cover one location or multiple locations?
One location, one license, one location.
And can a person have a concealed carry permit and be prescribed medical marijuana?
So I see no reason why they would not be permitted. What I guess I don't understand the question necessarily. That's not written in KRS 218B. I guess I don't understand where the question's coming from, but I don't see any reason why that wouldn't be the case.
Wonderful. All right. And one last one that just popped up that I think is an interesting question. If a dispensary is damaged, does the law address cleanup guidelines like hazardous material
So
issues?
that's a great question. That's actually provided for in our occupational safety and health guidance document that's on our website. And we actually require, so let's say that there was like a fire or something like that at a dispensary, we require any or at a processor, any place that's using certain chemicals to process raw plant material into finished products. We require them to label the doors on the outside in big bold letters what kind of chemicals or materials are being used in that area to assist again folks that are first responders so that they can be safe and understand sort of what they're dealing with. But again, all those hazmat issues or occupational safety and health issues are addressed in our guidance doc, and that's available on our website as well.
And we did miss a question. Thanks for reminding me there about regulations on dispensaries providing lock boxes.
I don't understand the question. Can we get some more on
Yeah, can we get
that?
some?
And Melissa Hall asked a question. I meant to keep, and I think this refers to an earlier one about over prescribing. So we'll be able to see the written certifications and what the certifications were issued for. So if an individual, for example, issued 1,000 certifications for chronic pain, we would know that immediately and be able to address that with the state licensing boards.
And then the lockbox question was around ensuring that there are no ingestions by children in the home. So providing people who get the product to lock it up at home.
So child resistant packaging is required by the law. And I highly encourage you to take a look at our packaging and labeling regulations. We take child safety and home safety very seriously. And that's another area where we're likely to be putting out some guidance docs on how folks can best store these products in their own homes.
And we had one more come in, and after that, we'll cut off the questions on this section and move on to the next. So the medical cannabis certified MD or APRN is providing the patient with written certification letter and monthly dose limit. Is this letter good indefinitely? Will they not be writing prescriptions with dose instructions?
Again, provided in KRS chapter 218B specifically talks about the written certification, how long it's good for. These things have to be renewed, and if one expires, is revoked, etc., it provides the process for how an individual would then apply again and go through that process. I think the question on conceal and carry was geared toward the issue of carrying weapons while high. I will say I am not a law enforcement officer, so I would refer those questions to folks in law enforcement. I'm not sure where those questions are coming from. Your local regional prevention center may be able to partner with dispensers to provide lockboxes at no cost. Well, that's good to know, and certainly whomever that individual is, if they would like to reach out, happy to have conversations about that.
Mr. Flynn, thank you so much for being here and sharing
Yep,
all of this great information. You did say that we could get a copy of your presentation.
sure.
And so if you could just email that to me, I'll make sure that that gets posted. We will be posting all this information with these resources that we've talked about and shared links to on the KPN website, which I'll give you a link at the end. But I want to move on and reintroduce Mr. Rob Duncan. He is the Deputy Attorney General, and he has agreed to come and share just a little bit of information about how his office is involved with this program. So, Mr. Duncan, I'll turn it over to you.
Thank you, Melissa. Appreciate the opportunity to be here today with you and the folks from the Kentucky Prevention Network. I want to thank Sam for his very informative and well done presentation. Uh, Honestly, Sam answered a lot of the questions that I was planning on covering in my presentation, which is I think which is a good thing. That'll let me focus just a few minutes on the Attorney General's office and the role that it may play in this space. But before I launch into that, let me also thank Bryson Denesi Quinn, who is an Assistant Attorney General in our office and is also here on the call with us today. Bryson helped get me ready for the presentation today. I don't have a PowerPoint, just a few prepared remarks, and then we'll be happy to try to answer any questions that folks may have. Just to touch on my background a little bit, Melissa has already indicated I serve as the Deputy Attorney General with the Kentucky Attorney General's office, and happy to be here on behalf of the Attorney General, Russell Coleman. As the Deputy AG, I serve as the Chief Operating Officer for the office, and I directly supervise the office's litigating and investigative functions, including our Civil Division, our Criminal Division, and our Department of Criminal Investigations. Prior to joining the AG's office, I was in private practice with a large law firm in Lexington, where I represented clients in commercial litigation and government investigation matters. From 2017 until 2021, I served as the United States Attorney for the Eastern District of Kentucky. And as the U.S. Attorney, I led an office of over 100 personnel, including 50 lawyers, and was the Chief Federal Law Enforcement Officer for the Commonwealth's eastern half. From 2005 to 2017, I worked as an assistant U.S. attorney in that office, where I investigated and prosecuted various violations of federal law. For about 6 of the years I was an assistant U.S. attorney, I focused on prosecuting large-scale transnational criminal organizations that were engaged in drug trafficking and money laundering activities. And during that time, I was fortunate enough to work with one of your board members, Bruce Crouch, when Bruce was a detective with the Nicholasville Police Department. So shout out to Bruce and the good work that he did in that capacity and currently still does as an SRO. So I've been asked to speak just for a few minutes about what community coalitions, prevention professionals, and Kentucky citizens should expect with the forthcoming implementation of the medicinal cannabis laws and regulations in the Commonwealth, and more specifically to provide information about the role of the AG's office. And let me preface this at the outset. Lawyers love disclaimers, and let me say that this presentation is just for informational purposes only and should not constitute any legal advice. And obviously, I'm not expressing any personal opinions, rather just discussing what the role of our office is and what the state of the law is. At the outset, before I turn to the issue of medicinal cannabis, just to make clear, recreational marijuana is still illegal under Kentucky law and under federal law. So the distribution, the possession, the sale of marijuana is prohibited. And Senate Bill 47 and the accompanying regulations made certain exceptions that Sam discussed for medicinal cannabis, and those are written into the Kentucky Revised Statute Section 218A that deals with marijuana, the criminal possession and distribution, trafficking, cultivation of marijuana. So one of the topics that Melissa and Bruce asked me to touch on was what the Kentucky Attorney General's office has done to prepare for the rollout of medicinal cannabis. And I think really the administration of the law, as you saw from and heard from Sam's presentation, a lot of the work to be done in drafting the regulations that will accompany the statute the General Assembly has passed comes from CHFS, and Sam has already covered that. The AG's office will become involved necessarily on a case-by-case basis to determine whether there is a violation of the law. One of our core functions in the Attorney General's office is law enforcement, and my background primarily has been as a prosecutor and in the law enforcement space. Our Department of Criminal Investigations will assist local law enforcement in upholding the law and will address issues, like I said, on a case-by-case basis. DCI is the investigative and law enforcement branch of the AG's office and is comprised of sworn detectives who are cross-trained in several investigative fields, including cyber crimes and, more importantly for this discussion, drug investigations. DCI investigates crimes that other Kentucky law enforcement agencies may not be equipped to handle, and works in conjunction with other state and local agencies, including the state police and other federal agencies on investigative matters. Our Office of Special Prosecutions in our criminal division serves as the lead prosecutor in cases that our office has primary jurisdiction. I should note here that most crimes that are prosecuted in the Commonwealth are prosecuted by the Commonwealth and county attorneys who have primary jurisdiction over the vast majority of criminal matters in the state. Where our office comes to play in special prosecutions is if there is a conflict that the Commonwealth or county attorney has and they ask us to get involved, or an enumerated exception of other state officers may ask our office to get involved. or when a Commonwealth or county attorney asks specifically for our assistance. And that happens rather routinely, very frequently. As a matter of fact, we work hand in hand with our Commonwealth and county attorney partners across the state to uphold and enforce the law. Another way that our office provides assistance, and I think pertinent to this discussion, is in the area of consumer protection. Sam had a slide in his presentation that touched on that. And our Consumer Protection Division helps safeguard Kentuckians from unfair business practices by enforcing the Kentucky Consumer Protection Act. The Consumer Protection Act makes it unlawful to engage in false or misleading or deceptive business practices. And just like any other regulated any other business, medicinal cannabis distributors would fall in under that, and certainly those that are purporting or suggesting something that frankly they don't have a license or a ability to do yet would be something that our Consumer Protection Office or division would look at. The intent of the Consumer Protection Act is to protect the public interest and uphold the well-being of both the consumer public and those businesses that are engaged in the ethical business practices. We bring suit on behalf of the citizens of the Commonwealth under the Kentucky Consumer Protections Act, and we'll investigate matters that are brought to us civilly through the use of civil investigative demands and the civil investigative process up to and including going to trial if necessary. Most often the cases under that we bring under the Consumer Protection Act, there is a resolution that is reached before trial where the party can enter into a settlement agreement for the relief sought. If you do learn of complaints or have complaints to raise regarding consumer protection, you can do so at our website at ag.ky.gov. Going through my notes, it looks like Sam has, in his presentation, has covered really a lot of the regulations related to who can possess lawfully medicinal cannabis, how medicinal cannabis is to be dispensed, and so I won't repeat that. Looking to see if there are other topics. I'm happy to at this point answer any specific questions that folks may have.
We do have a question that came up in chat about will the standard field sobriety test currently used for alcohol and other substances be employed for medical cannabis also?
That's a great question. I think that's something that would be probably more appropriate for Sam to address if he's able. I know that he mentioned in his presentation that his soon-to-be office is working on some law enforcement guidance and policy. So Sam, I'll kick it back to you on that.
So I'm sorry, what was the question, Melissa?
About will the standard field sobriety test currently used for alcohol and other substances be employed for medical cannabis too?
That's a great question, and thank you so much, Rob. I really appreciate it. I think this is a question that's going to be answered here in the next several weeks and months. We're looking at providing some law enforcement guidance that will be more fulsome, and we're working with KSP, with our law enforcement partners across the state, and with the Justice Cabinet and DOCJT on what that'll look like. So we'll have that in the next several weeks, several months, and make sure that gets out to everyone.
Okay. Let me check the. Doesn't look like we have any more open questions in the Q&A or in the chat.
Well, if there
Oh,
are no questions, again, I appreciate the opportunity to just touch briefly on the role of the AG's office. If you do have further questions about the Attorney General's office, again, feel free to visit our website at ag.ky.gov, or you can contact us there either through the website or on one of the numbers listed there.
wonderful. And I want to thank Mr. Duncan and Mr. Flynn again for being here with us today and sharing such useful information. I also want to just take a couple of minutes to thank my colleagues on the Kentucky Prevention Network Board. Bruce, especially, thank you, Bruce, for all your heavy lifting on this event today. But we also have Marissa Hunter, Sailor Almer, and Diana O'Toole here on the call also. Want to say thank you to you guys for all your help with the board's work. I am going to share some links in the chat for folks. The first one is our KPN website, and this is the site that where we will post information about this session. We will have the recording of the session available. It takes a while to get it edited and up, so give us a week or so to get that up there. But we will also make available links that have been shared today and the slide deck that was presented today. So I encourage you to go and take a visit there to our website. If I can get my computer to uh, work for me there. I think it's in the chat now. We also have a link to the cannabis prevention toolkit that we've been we've been given permission to share that as well. So I'm going to post that in the chat, but it will also be on um, the website for folks to get to. Another quick mention is our fall conference that will be happening in Lexington, and that is happening um, and I wish I could remember the exact dates. Bruce Sailors, anybody remember the exact dates? It's like the last day of September and the first day of, of October, like the 29th and the 1st, I think. There will be information on the website about the KPN Fall Conference. It's a great event. We'll have 2.5, 3 days of really great presentations to share with folks. So we hope that you can join us for that. Registrations will be opening up soon for that. They're not currently open, but we're going to get those up and running really soon.
Melissa, September 30th, October 1st.
Thanks, Bruce. On the spot there for me. I appreciate that. And lastly, I want to thank all of our attendees today. Thank you guys for the work that you do across Kentucky. Know that you are appreciated and that your efforts are important and that you're making a difference across our state. So thank you for joining us today and have a great rest of your day.